Scientific breakthroughs are revolutionizing the way we treat diabetes, and the latest improvements in screenings provide an unprecedented opportunity to prevent or delay type 1. To combat the risk of developing type 1 diabetes, the American Diabetes Association, along with the support from Sanofi, has put screenings at the forefront. Preventative screening for type 1 diabetes is a remarkable breakthrough, one that will reduce the risk of devastating complications such as diabetic ketoacidosis, DKA, and allow people to take ownership of their health. Even delaying type 1's onset by a few years could be life-changing for patients. Together, ADA, along with Sanofi's support, is supporting healthy living and investing resources so that no one dies from complications such as DKA.
We have made strides in the science of type 1 diabetes. Now we can offer people who are at risk for type 1 diabetes, or even some people in the general population, screening for type 1 diabetes. That is likely to reduce the burden of having to show up at the emergency room or to end up in an intensive care unit.
Type 1 diabetes can happen at any age, at any time, at any person, at any lifestyle.
There are 3 stages. There's stage 1, stage 2, and stage 3, which is the actual development of type 1 diabetes. And we would like to catch them at stage 1 and stage 2 so we know what's coming down the pike. So in stage 1, there's the development of one antibody, okay, with no problem with blood sugars. Stage 2 is where it develops 2 or more antibodies with the development of something called dysglycemia, where you see erratic blood sugars. They do not have diabetes, but clearly they're at risk. And then stage 3 is the development, along with the antibodies, of actual blood sugar problems. People that don't do diabetes every day may not be aware that there is a way to screen for diabetes. So what we're trying to do, along with different stakeholders in the country, is educate primary care physicians, school nurses, along with the public, about the ability to screen for diabetes to know what the risk is.
Our ambition is to reduce the number of ketoacidosis in emergency care and potentially save millions of lives.
So who should we screen? Well, definitely those people with a family history of diabetes. They're at 15 times more likely risk to actually have diabetes. And ironically, we're also seeing the highest rates of increase in our Black and brown communities. Some of those particularly most hit by COVID.
You can be screened for type 1 diabetes through your clinician, your primary care clinician, or endocrinologist, or for children, their pediatricians. And what they order is what we call antibodies. And there are various types of antibodies, and there are specific ones that we list in the guidelines. So how to get screened for type 1 diabetes? For those who especially have a family history of type 1 diabetes, they can discuss with their clinicians, whether it's primary care, whether it's pediatricians or endocrinologists, to get tested using antibodies.
So what can you do? Well, help us join this movement. Be part of the initiatives that the ADA has put together for type 1 screening, and get out there, get people screened so that everyone can have a softer landing. And we don't have people saying, I didn't know that this could have been prevented.
We have great tools at the ADA, and actually you can reach them from the ADA website. And we have Institute of Learning, and we do regularly seminars, webinars, and then there's a lot of online resources and tools that you can get access.